Hi there, everyone. Thanks for joining us, or thanks for watching if you're seeing this at another time. We want to begin by wishing you all happy Easter
Happy Easter.
and whatever Easter means to you. It's I guess a day to Easter Sunday. We caught up with family, which was lovely, and in fact, it made me think about the film that we watched a few weeks ago. We've actually viewed it twice, Christpiracy. Very interesting, and it does make you think about sort of all that you've been taught in regard to Christianity and other religions over the years. You want to add to
Particularly,
that?
particularly in regards to, the thou shalt not kill and, killing animals, and whether in fact, there is a spiritual way to kill animals, and that most of the major religions at their roots actually don't really support this.
And so, what have we been up to the last few weeks since we last did a live stream? Well, we had our immersion in the Yarra Valley. It finished Sunday last week. Was it only a week ago? Or was it 2 weeks ago? Now I've lost track of time. Maybe it was 2 weeks ago.
2 weeks ago.
And as always, it was just delightful. We had quite a small group, but we always find, even people that just don't expect it, that by day 6 they are finding health benefits that they never imagined. Do you remember some of the ones that we always try and capture this on the last day?
They're sort of measurement numbers type things, like people excited that their blood pressure's better than it normally is. But there's also sort of qualitative things where people say, look, I feel so much better. I feel so much, um, you know, I feel so much more clarity in my thinking. That's just something that I don't see from by prescribing a blood pressure tablet or a cholesterol tablet. That people come back and tell me they feel great.
And Sonia's asked, can we do one in southeast Queensland, please? Well, help us find a venue and we'll consider it. We really will.
We're currently considering a sort of a mini program format, which would be a fairly focused on the sort of nutrition and the practical, a little bit like a webinar series, but with lots of cooking demos and the experiential part. But thinking more of a sort of weekend event, possibly with an extension to a Monday as well. And we'll be trialing one of these in Victoria, and I guess if that goes well, it's a possibility.
We've certainly got enough content to package any length of retreat or from a one-day seminar through to the 7 days. And
I think we could do a 2-week one.
One of the things that why we love the 7-day, even though we understand it's hard for people to make the commitment to to travel to just out of Melbourne in the Yarra Valley and spend 7 days with us, is because of what we see when people have eaten, the beautiful whole food plant-based meals, which are quite low in fat, absolutely no oil, very low in any sort of added salty condiments or anything. So people actually experience quite things like arthritis pain going away. It takes 4 or 5 at least days, maybe 6 days for that to happen. And so if we only spend a weekend with you and you have some health issues, you won't quite see that. But we certainly, as I say, if we do go ahead with a weekend retreat, we're back in close collaboration with our initial immersion partner, Anita Ricky, who runs the Diggers Veggie Kitchen down in Anglesea. If ever you get to Anglesea, it's a whole food plant-based cafe. She does have a few delicious, rich things, but you can order whole food plant-based oil-free food from her. So yeah, watch that space later this year. And we were also going to talk about we start with the niacin, would you want to talk about which one?
Oh, I was just going to say that Neil Barnard from PCRM, his new book has been released. The Power Foods Diet.
That's right.
I've only just started it. It seems like it has quite a focus on weight loss. So I was lamenting to Jenny about all the focus on weight loss, but most of Australia needs that. Most of the world now needs that. And so he's focused in his book, talks about how whole plant foods, some more than others, have a role in controlling appetite. They actually result in natural release of hormones like GLP-1, the one that people take powerful, high side effect drugs to do. And how eating whole plant foods, means that less calories are absorbed, and even that on a whole foods plant-based diet, that your metabolism increases a bit. So all these sort of factors mean that a low-fat whole foods plant-based diet, high in fiber, is an ideal sort of diet to control weight without this sort of food rationing and deprivation.
And I think the reason Malcolm says, rather than, he wishes there wasn't so much focus on weight loss, even though there's lots of people who want to do that, because it's really the focus should be on health. We eat this way. You want to be eating a healthy diet. Weight loss is a wonderful side effect of eating a healthy diet. So I said that we would talk about the post we did yesterday on niacin. And it's and some of the latest research on that.
Yeah. The Stanley Hazen's lab at Cleveland Clinic, they're the ones that discovered TMAO and didn't just go, oh, look, we found TMAO. They sort of looked into it in more and more detail. Earlier last year, they discovered another thing, PAG. Don't ask me to say what that acronym is without revision. It's a phenylalanine derivative when you have more phenylalanine in your diet from artificial sweeteners or probably from higher protein intake in general. The microbes make this PAG, and that's another heart risk factor along with TMAO, which is well established. Anyway, the latest one is they sort of pull through people's blood and compare it to their heart risk. And they came up with a couple of new molecules, 4-PY and 2-PY. Where do these come from? These are breakdown products of the vitamin B3 or niacin. They're really only there in significant amounts when you have excesses of niacin. And he found, yes, that they seem to be associated with heart disease, and that it seems that high level of those lead to vascular inflammation, like increases in vascular inflammation factors. People who genetically had higher levels had more of those vascular inflammation factors, as did other experimental sort of lab models as well. And so niacin, dietary niacin, can come in the form of nicotinic acid, and that used to be used to lower cholesterol. It did lower it a bit, but it didn't actually reduce heart risk. And it's possibly because it increases the 4-PY and the other one that actually seem to be heart risk factors. There's another niacin form called nicotinamide. And that's the one that's been found to be quite effective in reducing the risk of recurrent non-melanoma skin cancers. But even the Australian author who discovered that you could treat people who were getting these recurrent skin cancers with nicotinamide, has said this is a treatment for a particular group of people at very high risk. This is not something that we could say will benefit the general public. So stop taking niacin to prevent skin cancer, unless you get dozens of non-melanoma skin cancers repeatedly, in which case the treatment may be worth the risk. The other thing is that over the years, we've been worried about pellagra. Anyone seen any pellagra lately? No, not me. Although I did want to see a case of scurvy. But plague was vitamin B3 or niacin deficiency. So we've got this long history of requiring that some of our foodstuffs are fortified with it. And you notice if you look at your breakfast cereals, they'll all go contains B1, B2, B3. And it's like we're all going to get deficient on those if we're actually, eating some reasonable food and things. Um, so we get extra niacin from these fortified foods, but in addition to that, people take all these, high vitamin B supplements, high dose B supplements. Some of the energy drinks have high levels of niacin in them. And so this will lead to people having higher 4-PY and 2-PY levels and having a higher risk of heart disease.
So Sam's asked, is niacin found in plants? So sources of
Yeah,
niacin.
niacin is found in whole grains, legumes, and vegetables, but not in excessive amounts. So the message is this is sort of part of a general principle that when you take a nutrient and isolate it and take it in, concentrated amounts outside of its normal context, then it's not a just in case. It's something that really could do you harm and have risks, like this research on niacin suggests.
Okay, so the other topic that you've been writing about, haven't got a post yet, is
No, I haven't finished writing about it.
on blood monitoring.
And I guess a couple of things led to that. One was a podcast called Inside Exercise, and I think it was number 78. This is an exercise physiologist who chooses experts in their exercise physiology fields in the world and has them on his podcast. These experts on number 78, I think it was, on glucose spikes, were experts on, glucose monitoring and blood glucose spikes. And this term, blood glucose spike, has come into into our language and sort of feared, like you eat food, and especially the low carbohydrate people who, think it'd be healthier if we just ate meat and fat. Um, they sort of, one of their hypotheses is that when you eat carbohydrates, you get a rise in blood glucose and subsequently insulin. And this is a really bad thing and causes, diabetes like damage to the body. It's simply not true. Um, but the people selling continuous blood glucose monitors, that's a little thing you can have on your arm, a tech device, sync with your phone and things, and it'll give you a continuous readout of what your blood glucose level is. And then you can identify which foods and which meals cause spikes, in other words, a rise in blood glucose. The experts in this podcast emphasize very strongly that a rise in blood glucose after a meal is normal human physiology. The only bad thing about it is if it's in someone with diabetes or insulin resistance, it can be an excessive rise in blood glucose. And rather than lasting an hour or so and then going back down again in those people, it could be hours and hours before it returns to normal. And in people with diabetes and to some extent pre-diabetes, they will tend to have elevated glucose levels all day long. So that's not a good situation. But the rise in blood glucose following a meal and then the fall again is actually quite normal, healthy physiology. The other situation when that happens is during and immediately after intense exercise, you get a glucose spike, a rise in blood glucose, because the body, has this readily available fuel that it increases the level of it in the blood for the working muscles. I don't think the low carbers, I think, would agree with me that this is probably not a bad thing. This is probably normal physiology as well. And I guess those wearing CGM, continuous glucose monitors, part of the idea might be to prevent diabetes by identifying foods that will cause your glucose to rise more. The irony is that some of the carbohydrate-rich foods, like whole grains, for example, will cause a rise in blood sugar, but they're associated with lower incidence of diabetes. So whereas some of the foods that are most implicated in the development of type 2 diabetes, like processed meat, red meat, eggs in particular, actually low carbohydrate food, and you continuous glucose monitors say they must be harmless because the glucose doesn't go up after them. So that's quite misleading. The other thing is you see the glucose, you have the continuous glucose monitoring. I had a bowl of oats and my glucose went up. Therefore, these oats must be bad. But there's a next meal effect. If you're eating high fiber food, particularly legumes, then at the next meal you could eat the same amount of carbohydrate, uh, and you get less of a rise in blood glucose. Or the opposite effect is you only need to put someone on a keto, extreme low carb diet for a few days to make them totally insulin resistant. Then they'll, eat a potato or even some oats and get this big rise in blood glucose. They'll go, aha, those carbs are bad. I better stick to my meat and eggs. So I guess when you consider all that, there's these devices that carbs are
Oh,
bad.
we've lost the internet. Oh, sorry, we dropped out of the internet just for a moment. It's back, I think.
Who should use a continuous glucose monitor? Someone with diabetes, someone with poorly controlled type 2 diabetes. Certainly, they're a godsend for people with type 1 diabetes. No more like pricking your finger all day long to sort of see what your glucose is doing. You can just, get a continuous readout, and I guess that continuous glucose monitor can sort of, identify, that and help you and your health professional to sort of change the doses of your, play with your long-acting and short-acting insulins to sort of get a more normal physiological situation.
Okay. There's been a question on the niacin for essential tremor. This person does take niacin. Should they perhaps decrease it?
Yeah, I think you should decrease it. Yeah.
Okay, so we will take any questions that you have, but anything else we've been listening to and reading and enjoying? I go blank when I think about what I've often got headphones in, listening to podcasts. What else have you enjoyed?
I'm enjoying listening to the sort of current Mastering Diabetes podcast. Pardon me. They brought into the podcast Lauren and Kylie. Lauren, Kylie is married to Cyrus Kambata, and is a nurse by training, but also an educator and works with their program. Lauren is a dietitian and has type 1 diabetes and works with their program as well. So that's been very interesting hearing about, how to this very day, people with type 1 are sort of, watch out for those carbohydrates. Kylie says, first date with Cyrus was a canoe trip, and he said, don't bother, I'll bring all the food and everything. She knew he had type 1 diabetes, and they ended up feasting on all these huge ripe mangoes, like, I don't know, 10 or 20 of them as their food for the day, and so obviously getting smothered in mango and washing them off in the river on their canoe trip. And she sort of was sort of a bit bewildered that Cyrus, with type 1 diabetes, was, happily pricking his finger now and then, taking very, very small doses of insulin because eating all those fruits and high fiber carbohydrates, he's got excellent, glucose or insulin sensitivity, and that and this sort of was her day job was treating children and adults, and of course, they're avoiding carbohydrates and they're being careful not to eat mangoes and things. But I think that the two bringing the two ladies onto the podcast program sort of I think adds an extra dimension to the program in terms of coaching and some of the emotional and practical side of it. So yeah, I recommend that podcast.
And actually, I was thinking about, one of the features, if for those of you that don't know, the Mastering Diabetes team is, they're on a mission to, what is it, reverse
We're on a
insulin
mission to
resistance in
reverse.
1 million people.
They'll do it too.
But the key to doing that is to lower the fat. And Cyrus talks about a metric of around the fat a day, which you get some in your oats, in your chickpeas, and so on. It leaves very little room for any added fat. So I'm segueing into Sonia's question: did we read the latest article from Dr. Campbell re fat? And I'll say no, I haven't, but I have seen articles he's written in the last few years where he's talked about not focusing on, we eat a whole foods plant-based diet, not focusing on any of whether it's nutrients or the macronutrients. But we do, I think, as I say, not having read what Sonia's talking about, but other things that he's written, we do find that our clinical experience shows us that if people include just a little bit of those high-fat plant foods, the nuts, the seeds, the avocado, maybe they're not too careful of avoiding oils, it makes a difference to their health, particularly, certain chronic disease conditions, arthritis, makes a huge difference. So, all I'll say is I haven't read the article that you're referring to.
No, I saw it and I started reading it this morning,
Mm-hmm.
but didn't get very far.
Had a
We
busy
did,
day
of course,
today.
write an FAQ a month or two ago called "What about good fats?" So in our FAQ, and when Jenny was saying people eat a little bit of nuts and seeds, humans are driven towards eating rich food. Fatty food is the richest food. And when you say a little bit, by the time someone has, 4 tablespoons of different seeds with their breakfast and a cashew sauce, and then they eat a whole lot of tofu and maybe some handfuls of nuts, it can end up with actually quite a high fat diet and quite a few saturated fats. And, whether we're looking at Pritikin, Barnard's research, McDougall, Ornish, Esselstyn, they're all at the lower, fat end of the whole food sort of spectrum of foods. Like, McDougall would say that the nuts are sort of like a seasonal food, a sort of feasting food. And, the way that they're being eaten by many in the whole foods plant-based community is sort of like as a central staple. I'm sure there'll be some people who do well on that, but I see lots of people who it doesn't help their weight management, it doesn't help their cholesterol, and it doesn't help their blood sugar control.
Well, if there's no other questions, anything else you wanted to talk about? I think we don't want to keep you for too long, so if anyone else has got a question, you want to throw it into the chat. Otherwise, we'll do another one of these in a few weeks. We haven't set ourselves a particular schedule for them, but we just want to keep in touch with those who want to listen to us. Keep putting ourselves out there, and we do have a webinar series coming up next week. So our webinar series is aimed at helping people understand what is a whole food plant-based diet, why eat a whole, what's the science behind it, and then we sort of drill down on some of the more practical things with a look at calorie density. And that's where, when people really take a close look at calorie density, they realize that there's not much room for nuts and seeds in their diet if they want to keep the overall fat content low. And so we've got that starting next Sunday. If anyone wants to join us, I'll put a link to the registration form in the chat. So we're doing another of our 7-day immersions in September, and so I'm just starting to take registrations from that, meaning that I've got a few people on my list, but to actually start taking deposits for it. Anything else we've got coming up?
No, not really. But I guess to comment that some of the our posts been a little bit sparse the last 6 months, like the one on niacin and the little thing I'm writing at the moment on these glucose spikes. rather than just having them randomly sitting in, newsletters, Facebook posts, we're going to start importing them into a blog section on the Whole Foods Plant-Based Health website.
So that then we can link them from any appropriate place within the website, because it's it's been built by a librarian as a resource guide for people. So we can link some of these when within their rightful place. And it also means that the information will be shared with those who are not on Facebook. We do upload these videos to YouTube. So again, if you have a friend you want to share this with and they're not on Facebook, you can find our YouTube channel, which is Plant-Based Health Australia. So I think we'll say good night, and until next time, eat well, stay well, and see you in a few weeks. Okay.
Good night.
Good night.